Welcome back to another episode of the most authentic but nuanced holistic health and fitness podcast, hosted by your favorite crunchy strength and conditioning coach. I'm Kelsey Moore, and today's company is Dr. Allie Ryan. She's an athletic trainer turned physical therapist and has been practicing for 5 years. She turned to pelvic health after her own struggles with pelvic floor dysfunction, and her passion is to educate and empower those who have suffered from pelvic floor symptoms and have felt unheard by the healthcare system. She's also a fellow military spouse and has 2 kids and 1 on the way. Welcome to the show, Allie.
Thank you for that intro.
Absolutely. Thanks so much for taking your time just to talk to us today.
Yeah, of course. I love talking things, all pelvic health.
I know. And you're so good at it too. You've been doing so much in the local community. And I mean, most of the people probably listening to my podcast, like maybe or maybe not be in Moore County, but you've been all over Moore County. So tell us how you practice currently and maybe take us from your journey from being an athletic trainer and going to PT school.
Yeah, absolutely. So I feel like most people have this emotional story of how they got into PT school. That is not me. I feel like I sort of had this road paved for me. So I went into undergrad. I went to University of Georgia. I was exercise and sports science. I've always been in the athletic kind of realm. I did swimming, softball, competition cheerleading, lacrosse, track. I kind of did it all back in the day. And then I was like, yeah, that makes sense. I'll do that. And then someone just came to our room to talk about the athletic training program. And I was like, how cool is that? I can go work with the athletes. And I actually got to work with the UGA swim team, softball, football team, soccer, women's soccer. And it was such a blast. And I loved like every part of it. And then from there, I went on to a small D3 college, Emmanuel College, to work as an assistant athletic trainer. And that was kind of a shell shock for me for sure.
Yeah.
And it's because I went from University of Georgia. They have everything. They have a trainer for every sport and all the equipment and EMS on standby at every game. And then when I went on my own as an assistant athletic trainer and I'm all by myself and I don't have all the fancy things and it's chaos, I realized how much the acute care terrified me.
Okay. I want to talk about this.
Oh, and I married a medic. So it's like, it's just funny because we say we kind of combined for the perfect match, right?
There you go.
But yeah, the amount of stress was insane. If you know anything about the athletic training world, you already know it's insane. The hours are grueling. The pay is usually crap, to be quite honest, unless you're at this super high level of athletes that you're working with. But I basically got to the point of, I can't do this the rest of my life. Especially, I knew I wanted a family at some point. I was like, I can't do this. I don't love it as much as someone who needs to love this in order to put in the hours for it because it is so grueling. But I always loved the rehab part. And I'm just a connections person. I love the one-on-one connection with the patients. I love following from a time where they felt like they probably want to get back to seeing them grow and develop. And I think that is phenomenal. And that's what led me to go back to school, do it all over again after 2 years break and get into PT school from Georgia State University. Now I'm 5 years out and here I am.
Awesome. Yeah. I knew you were an athletic trainer from your undergrad because we're friends in real life, but I've never asked you or we've never talked about that dynamic. I mean, when you work in college athletics, regardless of what division it is, like it is a whirlwind of just like understanding. I'm sure you've felt the same way. I always talk about like college athletics is the craziest place because they like hold like this carrot in front of you saying like you get to put this school on your resume, but we will underpay you and overwork you. And unfortunately, athletic trainers get the absolute worst of that. Strength coaches are bad, but athletic trainers, I would argue, it's always the worst, and it's the worst hours. So that's tough. Did you feel that?
Oh yeah. I mean, you're there before the athletes get there. You are the last person out of the training room.
Yeah.
And it's not just, I think some people think it's just game coverage. Like you're prepping them. God, I can't tell you how many like ankles I wrapped or, just like all the crazy. At the UGA level is different because you just worried about one team. When I was at Emmanuel College, the small, tiny little D3, we just didn't have the support. there was 3 of us to support like 20 something different teams.
Mm-hmm.
It was chaos. It was like a zoo. You just
Mm-hmm.
are like, I don't even know who's coming on my table, but here, let's get you ready. Let's go. And you go have
Yeah.
practice. It was
Yeah.
insane.
Yeah, that really, really is insane. But it sounds like you started to really love the rehab side of it, which I
Yeah.
do feel like last comment on the athletic training scenario. I feel like athletic trainers, and correct me if I'm wrong, they are meant to be acute care. And oftentimes the rehab just falls on them because there aren't PTs at the high school level. There aren't PTs available at lower division colleges. And so then it's a fine balance between who does the rehab, the athletic trainer or the
Yeah.
strength coach or both. Or who's the expertise here in that area. And
Yeah.
granted, coaches and athletic trainers get the rehab piece. Obviously, there's overlap, but that is, I'm assuming, not necessarily supposed to be the primary of of being an athletic trainer.
But you're 100% right. You
Okay.
sort of, especially at that like lower level, like you said, high
Yeah.
schools or smaller colleges, you do sort of become, I think the scope starts to blur a little bit, or even
Absolutely.
within my scope of practice. You never want to do something that you're like, you know what, I really just don't know what the hell I'm doing right now. But
Hmm.
sometimes you start kind of learning these things. And like you said, you do get some of that rehab knowledge, not to the extent I obviously know now,
Yeah.
but it kind of just becomes this thing that
Hmm.
athletic trainers, yeah, you do start to become the rehab person for sure.
Sure. Sure. Yeah. I'm already going to acknowledge it. My dog's barking. I'm sorry. You can
No,
probably
you're
hear it.
good.
Oh, okay. Okay. So you became a PT, and then I
Mhm.
would say more recently you've gotten into pelvic floor
Yep.
PT. Is that right? Okay. Talk to us about that transition. Obviously, I always say anything, any provider of any sort that goes down a more progressive route in the way that they treat patients or clients, it's because they have an initiation story themselves. It always happens. Would love to hear as much or as little as you're willing to share and how you got into that.
Yeah. So I'm an open book, so you can honestly ask me anything. But it's funny because when I was in PT school, I was like, pelvic health, never. Like, not me. That's not going to happen to me. And I did have a rotation where I was with a pelvic health physician, PT. Um, I will say I practice completely different. She was
Hmm.
practicing more the old school way, which we can dive into a little bit later if you want,
Would love
with how
to.
I treat now. And then I was like, nope, not for me. And also, I will say that in school, the pelvic health knowledge you're given is minute. It is like I had one lecture on it, to be completely frank. It's
Hmm.
just so little. And then coming out, and I worked mostly in general ortho, some acute care, which is hospital setting, different than athletic training, acute
Hmm.
care. But I did work with another pelvic floor PT, so I like kind of got her patients sometimes, but mostly when they were done with like the private room setting. She was more progressive for sure. And I was like, okay, that's cool that she's doing that, but still not interested at all. Like I
Yeah.
love my athletes ortho. That was definitely my jam. And I think a lot of that stemmed from the athletic training, obviously.
Sure.
Then after my second birth, which I've had 2 cesarean births, I had issues myself, mostly pain with intercourse. I had some leakage happening, but a lot of it was pain with intercourse. And I did seek out pelvic health PT. The treatment I got, just in my mind, was not adequate. I'll just put it at that. And a lot of it has to do with just putting me in the room and having me on a little machine and,
Hmm.
not as functional as I think it should be.
Okay.
So then I was just like, you know what? Let me just take some courses, see what it's all about. And the first course that I went to, it was just such a light bulb, empowering moment, almost like a I don't want to curse, holy crap. I can't believe I haven't known this about my own body. Like
Yeah.
my whole life. And it was just like, okay, maybe I do. That's when I was like, I do want to do this.
Hmm.
Because to me, some people might think I'm pigeonholing myself into like one specialty, But honestly, I see it more as this missing piece to so much other things going on. Like
Mm-hmm.
the pelvic floor is working in a system. And I felt like I didn't have that knowledge to treat past patients with low back pain, hip pain that could have been a pelvic health issue. And I just didn't even think about it.
Mm-hmm.
And then it's kind of rolled into this like the resources aren't out there. That's infuriating, especially in women's health.
Sure.
And I'm just like, I want to be a voice for it. And especially we commonly get into the pregnancy postpartum world. That's not everyone I treat, obviously, but that's a whole nother world that I was like, oh my gosh, I can help these women and give them the help that I never felt like I knew.
Mm-hmm.
And it was just kind of this moment of like, this is what I want to do because I don't want people to go through what I feel like I went through.
Yeah.
And I want to offer the help that every person deserves.
Yeah. Yeah, I completely agree. I was grateful enough to get pelvic floor PT a couple years ago, and I ended up having a wonderful PT. I thought the care that I got was amazing, but it really did open my eyes to a whole other world. I mean, I say, my entire job is I'm supposed to be a musculoskeletal expert. I'm supposed to be able to train and to get people to the highest caliber possible. But if I have athletes, both male and female, that are showing signs of any type of dysfunction, I can honestly say I was not taught a single pelvic floor muscle
Right?
in my undergrad or my master's. Not a single one. Could you have probably convinced me we had no muscles down there? Probably. I would have probably said, you know what, there's probably a muscle to like help me use the bathroom. And that's probably about the extent of knowledge that I had, which is absolutely infuriating. But when I saw my wonderful pelvic floor PT, Laura, because I was displaying similar symptoms as you, but I've never been pregnant. It was just mainly pain with intercourse. And then also, I ran track for my entire life, basically. And my core was so strong at the time that it was to my detriment in regards to just being able to like relax, for example.
Yeah.
Um,
Like over gripping.
Over gripping, and it's still an issue I'm working on today. Like I'm standing here doing the dishes and like my butt cheeks are clenched to like the nth degree, and I'm like, this is still an issue that I'm still trying to work on.
You gotta shake it out.
I seriously, I know you post about that on Instagram all the time, and I'm like, no, literally, like I'm sitting here and my butt's clenching. I'm like, why am I doing this? Like I'm holding tension there. Like this is ridiculous. But I would love to know your opinion about your experience, like the old way of pelvic floor PT versus now your more functional way. And tying into a question I had for you is like, how are you tying that into like a classic strength conditioning protocol? How does that all translate? I would love to know your opinion.
So I would say the old school way is definitely more of the biofeedback way. And
Okay.
that's like the electrodes placed, and they have you sit in a room and they're like, oh, watch this little computer or a little device. When you contract, it goes up. When you relax, it goes down. What I don't like about that, the pelvic floor, I always say like the pelvic floor is going to pelvic floor. It's kind of doing its own thing automatically, and it's matched with your diaphragm and breath and abdominals.
Mm-hmm.
I don't often give a voluntary max contraction like that almost to anyone unless like we have some nerve stuff going on or it's a true like weakness. They don't have any tension going on there.
Mm-hmm.
Okay. The other thing I don't love about biofeedback is how unreliable they are. I mean,
Mm-hmm.
first of all, what are you doing? You're typically like side lying. They put the
Yeah.
electrodes on you. And I'm like, okay, go. What they don't tell you is there's from visit to visit, right? Because they're always about the numbers in that way.
Sure.
The numbers don't mean jack crap if those electrodes aren't exactly in the same place every single time, right? That's just
Mm-hmm.
how it is. So the numbers, honestly, I'm just like, whatever. Why are we even worrying about that? The other part I don't like is the crosstalk. A lot of times, like it'll pick up glutes, piriformis, things that aren't actually pelvic floor, right? So it's really not giving you
Mm-hmm.
the awareness that you need. I'm not going to say ever. I'm not going to say like never use it, but it's just, that's like one of the last tools I'll probably use.
Mm-hmm.
The other thing is, say they put it on you in side lying position, you stand up, now you have all this pressure going down, it's still going to read that. So it's not that you're contracting. I mean, you'll probably automatically have a pelvic floor contraction because of you're sitting up, you're standing up, all those things. But you got to now put gravity into it. Your glutes are now going down. So it's just not to me like the most perfect thing in the world that it
Hmm.
used to be, right? And I also think people use it to go see other patients, to be
Yeah, it's
quite
passive
honest.
for the clinician.
Exactly. And
Yeah.
that's why you see it often used in those big name clinics so they can put two more people on the schedule
Yeah.
and work around it. Um, the way I work, I am a full body practitioner. I obviously check the pelvic floor. I do internal work. I'm checking coordination, tension, all those things. But there's always typically something outside the pelvic floor that's causing it, right? Like I said, pelvic floor is going to pelvic floor. Usually there starts to be a dysfunction because of something else going on, and we need to figure out like why. Is it thoracic mobility? Is it how you're breathing, rib mobility, your core? Are you over gripping? Are we not getting the right contraction there? Hip mobility. It's like so many different things.
Sure.
So I think you just have to zoom out and be like, okay, we have pelvic floor tension here, but why is that happening? And yeah, I'll do manual to help kind of relieve that tension, but that's really to get me in the movement patterns that I want to see, right?
Hmm.
And then we have just new research coming out about hip rotational movements and how it can really impact pelvic floor activity and all those things. So I think it's just, and it's more functional. Like, who wants to just lay down on the
Yeah.
table all day long? It's not what we do in real life. So the old school way, I'm just like, I mean, I'm not just laying in bed all day long. I want some to do activities
Yeah.
that kind of integrate everything as a whole, right? So that's
Yeah.
practice. Hopefully I answered the question.
No, you absolutely did. You absolutely did.
Yeah.
Because before, well, I always say, like, granted, maximum contractions aren't necessarily like passive, like that actually is active because you have to do it yourself. But like I think I heard once, like you can't cure an active problem with a passive solution. Like you have to have that translation. So you have to
Mhm.
teach your client or your patient how to do what you want through a pattern that you want them eventually doing. Like if you're only teaching them how to do, relaxation techniques or whatever you need to teach them within a sideline position, but then they're out running, they have zero idea as a client or a patient
Exactly.
how to make that adjustment for themselves. And so I think it requires a really hands-on PT and a really knowledgeable PT.
And like
Yeah.
you said, like with running, you're not thinking, oh, contract, contract, contract your pelvic floor. It's just going to do it if it's
Hmm.
functioning appropriately. But we need, again, the right movement patterns to get there. So it's able to have that full range of motion.
Hmm. Yeah, that's
Yeah.
really, really good stuff. So again, on a personal level here, so it's really interesting because you asked me about my race, which is in 2 weeks. Getting very excited for it. The interesting thing is, like, I never have like pelvic floor discomfort, like, ever. I've never been pregnant. I've never had children. So like I feel like a teenager, really, in regards to just like how my body moves. Like, granted, I'm like slower in certain areas and yada yada, but I'm basically the same for the most part. But it's interesting, during my last two 50Ks, when I get around like 25 miles and I get to an aid station, I'm starting to get like a little tight. So I like try to squat just to like get some movement in. Oh my gosh, my undercarriage is so tight. So tight. And I'm like, is this my pelvic floor? Like, I'm trying to like coach myself in the moment, trying to stay focused through the aid station. But at the same time, I'm like, this is what they're talking about, how your pelvic floor takes a flipping beating while you're running. And
Hmm.
I had never experienced that. And I hope I don't sound like ridiculous, like, I've experienced it on mile 25. Like, that's really not what I'm trying to say. I'm just trying to say, like, it's really expanding my mind on how the pelvic floor is integrated while running. So can you just give us like a quick breakdown of what's going on while you're running, or maybe some common activities, even biking, maybe some of those?
Yeah. So you're so funny. And I just like, you don't have to be pregnant or postpartum to have pelvic floor. It can happen to anyone. You got a pelvic floor, it can happen to you. Male, female, whatever.
Mm-hmm.
Okay. So with your running, I mean, you're doing a 50K, right?
I'm training up for a 50 miler. 2
50
weeks,
miler.
50 miles in 2 weeks. Yeah.
God, you crazy person. Maybe one day I'll have them. But I think of it as like with you especially, it has been a pretty quick training program. How many months have you been doing this?
I'm probably on month 6, 5 or 6, month
Okay.
5 or 6. Yeah.
And it could just be like that progression. Your pelvic floor is not used to it. It's also like however your form is changing while you're running, it's gonna change, especially since you're
Sure.
doing, you said it's a trail run. So
Yeah.
you're doing like a lot of different like swerving and going over different
Yeah.
surfaces and climbing and hiking and all those things. So it's gonna be activated throughout. Like I said, you're not gonna consciously think about it. It's already gonna try to do it because it's supporting. I mean, it's supporting your internal organs and it's also going with your movements while you're running.
hmm
So when you get to that 25, you said 25, like 30 mile,
hmm
honestly, it's probably just like, oh my God, what the hell is happening? We're not used to this as much because we know you
Sure.
are training, but we still got to get to the point of like your body's like getting more and more used to it. So sometimes you go through those aches and pains and have to figure out, oh, what's happening with my posture and stuff. So usually I say like when you feel that tension, you're like, oh my God, what's happening? I like to explain it as it's holding on for dear life. Like, oh my God, what's going on? Why are we running so much? Is kind of like how I would explain
hmm
it to someone because it's just going through that constant like contraction. It's probably not fully relaxing because we're running and doing all these things and have all this movement going down. So it's probably honestly just like tired and like, holy crap, this is a lot more than what we were used to about 6 months ago.
Yeah.
And so let me just hold on, and I'm just going to hold on here to kind of protect myself. That's what I'm assuming is going on. You never
Makes
know.
sense. Makes sense.
Sometimes.
Oh,
But
keep going.
a deep squat is good for you. What I would recommend is like if you could hold on to something and kind of like lean
Oh,
down
yeah.
into it, so then you can kind of rock, and that way the weight's going through your arms instead of kind of down and
Makes
rock a little
sense.
bit. That might help a little bit more to relax
Good
you.
to know. New
Yes,
tools in my tool belt. This is
yes, new
good.
tools.
I know. Okay. Can you give us a quick anatomy breakdown? My very basic knowledge on the pelvic floor is that it's all about pressure mediation, pressure through your diaphragm, your abs, and your pelvic floor. And it's like this 360 um, idea of like if you're mismanaging pressure in one area, then you will have pressure in another area, like a balloon, like you're squeezing a balloon, it's going to come out somewhere. Is
Yeah.
that, would you say that's kind of correct, or would you say it you have a more accurate description?
You mean as far as like the pelvic floor in general, or
Yeah,
like
like it's
related
just
to
it's just
dysfunction?
one side of trying to manage abdominal pressure. That's kind of what I have heard.
So it has a lot of different functions.
Okay.
And how I explain it, so your pelvic floor muscles, you have three different layers attaching from your pubic bone all the way to your coccyx. So it's just sitting like a bowl in your pelvis. Okay. And it has sphincteric control, it has sexual functioning, there's lymphatic drainage that's involved with it, breath and diaphragm, and posture. Those are pretty much like the main functions of the pelvic floor. Now, the what you're talking about, like the intra-abdominal pressure, what we see with that is usually when we have a dysfunction there, or we're not able to control the pressure the best that we can, or our body really could, that's when we do start seeing kind of the dysfunction kind of rolling in. But
Okay.
it is like playing a part of it. I always say the pelvic floor is the diaphragm's best friend. So when you are inhaling, diaphragm's dropping down, pelvic floor should really kind of drop down a bit. Exhaling, diaphragm's lifting up, pelvic floor should lift up. That is one pattern, I will say. Sometimes the body goes into different patterns based on what we're doing. But that's kind of like a generalized basic pattern of how it follows the diaphragm automatically. But you're right, we have that intra-abdominal pressure and thoracic pressure to kind of help control what's going on there.
Hmm. Okay. Okay.
Mm-hmm.
I this is so random, but I think I put it on my Instagram, I don't know, a couple days ago because somebody asked me about like period products. And
Yeah.
I once, like a couple of years ago, the Salt and a couple other brands came out with the cup that you just kind of like fold up, you put it inside of your vulva and your vagina, and it just sits
Yep.
in there. I'm trying to use the correct terms here.
Well, it's
And
the vaginal canal.
yeah, thank you. Vaginal canal, sitting in the vaginal canal. It pops open, but the seal is a suction. And then another version came out that was just a disc where you fold it up, you stick it in, and it just sits there. I had the immediate, because I had several people in my life who had had cervical prolapses after having children. And I had an internal moment of like, I don't feel like having a suction, like a vacuum pressure in there for an extended period of time is smart. So I did not opt for the suction one. I use a disc now from Salt and I really love it, but I'm really cognizant of that suction piece of it. Do you have an opinion about that? I would love to know.
Yeah. So I will say, and I think people think cups are like new. They're not. They've been around
Okay.
for a very long time.
Okay.
Like they gained popularity early 2000s, but I think the first one, I don't even know. I don't want to give a date because I'll be wrong, but it was pre 2000s. I will say that. You are right. So the cup, for those of you who don't know, like she said, you fold it in, insert it into the vaginal opening, and that sits in the vaginal canal via a suction pattern. The disc, it goes a little higher into an area called the vaginal fornix. So it sits right below the cervix, and you kind of tuck it in behind your pubic bone, and that's how it stays in place. So it's not a suction. I think suction is the scary word, right? Right now, there is no research supporting that suction causes prolapse, dysfunction,
Okay.
any of it. And in my professional opinion, I don't know if it truly would be strong enough
Okay.
to cause a dysfunction, if that makes sense.
Yeah.
I think the where the problem comes is actually when you take it out,
Okay.
you truly need to break the seal, which
Mm-hmm.
like I tried the cup too.
Mm-hmm.
And even as a pelvic floor therapist, you gotta it's like kind of uncomfortable.
It
You
is. Yeah.
gotta, like, yeah, they have a little kind of tail thing on the end so you can try to find it, and you're
Sure.
supposed to pinch it, break the seal before you pull. You should never pull before you break the seal. Never. Okay. That's where deep breathing can really help. If you learn, I don't like a full bear down. I teach like an inhale and a lengthening technique for someone who
Okay.
wants the cup, and then break the seal and then
Sure.
exit out. As far as research though, there's just nothing that supports that.
Mm-hmm.
Truth.
Okay.
I can sit here and be like, oh, that's definitely causing a
Yeah,
prolapse
which is understandable.
or dysfunction. And actually, some of my prolapse people have used the cup and liked it because it
Okay.
almost ported the vaginal wall a little bit.
Mhm. Okay.
For people who don't know, because I keep saying prolapse, prolapse is when any pelvic organ is descending out through the vaginal opening or the rectal opening. Okay, that's like a prolapse. And some people like the cup because they feel like once it's up, it kind of adds a little extra support to that vaginal wall. And they're like, oh, it actually kind of helps my symptoms a little bit. They kind of like it. But there are people who I've heard, like you said, the suction kind of irritates them. I never got comfortable with a cup, to be completely honest.
Mm-hmm.
And the truth is, everybody is different, honestly. So I'm like, if you love the cup and you like feel good with it, go with a cup. It
Mm-hmm.
shows that if you're using it properly, you shouldn't have any of those like issues. I
Sure.
think it's mostly the taking it out. I prefer the disc. I'm like you.
Mm-hmm.
I love salt. I prefer the disc. Honestly, I don't know. I could never get the cup. I couldn't even get it to suction like the way I
Yeah.
went. Like I can never get it, and I'm like, oh crap, I'm bleeding out.
Yeah, yeah. I know, and I've not had an issue with the disc, and I did find it to be easier to insert and remove. And I would say, maybe I'm off my rocker here, but because I have to like relax in order to insert or take it out, it actually does kind of remind me of like the different positions my pelvic floor can be in through my breath. And that was kind of like a small exercise that my pelvic floor PT was just like maybe keeping mind of was just it was a tangible thing that I was doing monthly, either with my cup or my disc, that I had to work on my breath and work on those contractions and relaxations.
Yeah, and it's hard in the beginning if you're trying to learn how to use it because you can start tensing up because you're like, oh, I can't get
Yeah.
it. So you really have to focus like on breath or try different positions, like one leg up or do it in the shower. I don't know,
Hmm.
whatever makes you comfortable to try to get you to be like, okay, okay. Sometimes you got to reset, especially in the
Sure,
beginning stages
for
of
sure.
losing one. But yeah.
The other thing I wanted to ask you about, I have wondered that this for like years now, is what are high waisted leggings doing to our pelvic floor and our posture? I don't know if you have ever thought about this in your practice, but I
Oh,
think
yeah.
about it. Okay, when I'm wearing high waisted leggings, I notice my posture because there is pressure on the outside of my abdomen. My abdomen automatically wants to provide counter pressure. Am I off my rocker or is this really happening?
No, no, no. It is. So I will say it depends on the brand
Okay.
and like how cinched it is. Cause like some
Mm-hmm.
really cinch around the
Yeah.
stomach and they're like, we're going to make you as skinny as possible
Mm-hmm.
to look the way you want to look. It can add a lot of pressure going down.
Okay.
So I'm always like, if you feel like there's an increase in symptoms one day, check your clothes because a lot of times it's sports bras that are way too tight, so your
Mm-hmm.
ribs are not expanding how they should, or the high waisted leggings. And don't get me wrong, like I love a good high waisted
Me
legging,
too, of course.
but if it's adding to your symptoms, it's time to try another brand, size. Like I always tell people, like you need to let your gut go sometimes because we shouldn't be
Mm-hmm.
sucking it in. And I think it is this toxic mentality that us women always have to be like this perfect little figure and suck it in. And I'm like, just let it go. Like let the belly hang a little bit.
Mm-hmm.
So as much as I love them, yes, you are not crazy. It can add pressure and you can start to feel like, oh yeah, it's kind of like a belt in weightlifting.
Yes, I'm like, can you imagine the pelvic floor dysfunction if someone was wearing a weight belt all day? It seems crazy.
It's just how you manage pressure. And if you're constantly bearing down or pushing down because you're fighting that sensation that's around your abdomen or in your tummy, that's a problem. That's when we need to relearn some things and learn like we don't need to be bearing down. We can disperse pressure to other parts of the body. My whole thing is 360 breath. And I
Yeah.
feel like I heard you say that too. So, or breathe into your lats, like bring it up into the ribs or bring it up into your lats because you don't want it all pushing forward and down. That's not what we want.
Mm-hmm. Yeah. No, that's good.
Yeah.
Okay, so I love to blend like holistic health, progressive health with also performance. I do think there's like a niche way that you can blend both without having to pick major sides. And one of my questions about blending either of these two sides is it is very common for high performing female athletes to urinate aggressively on a weightlifting platform when they're lifting. Now, the comment section on social media is freaking brutal on either side of the argument. Um, we recognize that leaking is a dysfunction, but how is that pattern improved realistically for a high performing athlete? Because
Yeah.
to tell a woman to be limited based on pelvic floor, that female athlete at that level, she's a dog, right? Like she's out to win. So how do you realistically attack that when their pelvic floor is under so much pressure? But how do you find that balance? I would love to hear your perspective.
So that can be very individualized, 100%. But I think there's this common thing that people think like, oh, she's peeing herself. She needs to strengthen her pelvic floor more. Like it's a strength issue. It might actually already be that she's like working out all the time, doing all these things, that it's already tense.
Okay.
So it's almost like I always use like the bicep example. It's almost like it's already like fully contracted. And then you add on the however many pounds that they're doing on top of that, and it's overload. So really, typically what I start to teach them is like you still need full range of motion of your pelvic floor in order to be functional. Okay. So we need to work on lengthening typically with that person because general tension is what I see most often, especially with my athletes. Because not only is it a pressure overload once you add the 250, 300, whatever, how many pounds you're loading on yourself, it can also that tension. So you have the pressure input, but then if the muscles are so tight, sometimes you reach that point where it almost shuts off the nerve to the sphincter because it's so tight that it just lets it go. So it's not getting as strong. That's
Mm,
kind of like another newer research is coming out about like
that's
the tension and
interesting.
how it's affecting the nerve, which I find very interesting.
Mm-hmm.
But like you said, I'm not going to tell this hardcore athlete, like, you need to stop weightlifting at all. I would do an evaluation on her, obviously, see what weaknesses. I always say my job is to find your weaknesses, right? Like I always tell people in the first visit, I'm
Sure.
like, don't feel bad. My job is to find your weaknesses so we can work on that. Also, with those athletes, they tend to have poor breathing patterns, poor mobility in their ribs and thoracic spine.
Mm-hmm.
Um, so those are things that can relieve some of that pressure going down. And you can also gradually progress certain, like, let's see if we can get down a little bit and work on our breathing techniques and how to actually activate our core appropriately and see if we can stop that leakage. Okay, now let's gradually progress so we can get you back to where you want. You just got to work with them, but they also have to
Mm-hmm.
kind of meet you halfway a little bit if they
Sure.
truly want that dysfunction taken care of. But the pelvic floor is like anything else. You can gradually progress something, kind of like a strength program,
Mm-hmm.
and implement these other bits and pieces that you know can help manage the pressure to get her to the point where she is not aggressively peeing herself from her lift. Once
Mm-hmm.
she does that. And I know a lot of people have a lot of different opinions about Valsalva. I
Sure.
think there are right ways to do Valsalva without pushing all the pressure down into the pelvic floor.
Mm-hmm. I
And I
agree with
think
that.
we're still trying to figure some of that out right now.
Mm-hmm.
And I hope there's more research on it and safe ways to do it.
Sure.
But, and I, even myself, I would say a couple of years ago, I'll be like, oh, avoid Valsalva. Like, but I have changed, like people change. I think that's the beautiful
Sure.
thing about what we do is there's new stuff coming out all the time. And I don't, and there's different breathing patterns for everything. So it's almost like you've got to kind of play around with the person and what they got going on to
Mm-hmm.
figure that out, which is fun,
Yeah.
honestly.
Yeah, and women's sports, man, they're still growing. They're still getting big. So I'm
Oh
like,
yeah.
the more women are in high performing sports, and they're at the elite level, more research studies will be had on them. Now, should that
100%.
have been done a long time ago? Of course, but we're working on it. We're getting there.
Yeah.
Yeah, so obviously on my regular full time day to day job, I'm working primarily with guys. I do have one female operator, which is amazing, but
Nice.
most of them are males. So, what are some of the most common male symptoms that maybe a coach it I know I'm not trained in it, so I'm not going to say that I'm going to overstep my scope here, but I like to think and I like to observe. So can you give me some ideas, like what should I expect if a male has pelvic floor dysfunction, or maybe he just has an issue with uh, postural awareness? What are some of the most common things you're seeing in males versus females?
So I only see women right now. It is my
Okay.
goal to see men in the future. But I haven't had like a designated course for men related things. They
Okay.
still they still have leakage, like urinary fecal leakage. They still can have general pelvic pain, or it can present as sometimes low back pain, hip pain, groin pain, and they have no idea it's coming from pelvic floor.
Okay.
Um, and then they have, I mean, they have prostatitis. You can get into like more just very male specific stuff. I don't work with them as much
Mm-hmm.
at all, actually, at this point. I don't work
Yeah.
with men at all at this point. And a part of that is because I'm mobile, for the most part. And part of that, I keep on going back and forth like, do I really need to take the male specific one? If I know the functions of the pelvic floor, I don't know. I'm kind of going through that on my professional journey for sure.
Yeah, that's understandable.
But if they are, and I'm sure you're really close to them, if they are complaining of things like leakage and pain, general pain, that's when I would refer out, honestly.
Mm-hmm. Yeah,
But I mean, I know you're looking at, are they stacking? I like to stack the
of
knee to the
course.
pelvis a lot of times. Obviously, you're going to break that sometimes when you're doing like a snatch or something. But then
Mm-hmm.
your abdominal eccentric control, like, do they have that? Are
Mm-hmm.
they over gripping? People love, especially guys, love to over grip in their upper abdominals.
I was gonna say, I would say that upper ab gripping is probably mixed with a limited thoracic mobility is going to be the typical combo that I see.
Yes.
Um,
Well, they ruck. I mean, the rucking
mm-hmm.
for how much they ruck is so much. I feel like
Mm-hmm.
just it locks them in.
Mm-hmm.
this posture. And then a lot of them start to grip those upper abs and they're just like
Mm-hmm.
doing that for miles and miles and miles. So,
Totally. Yeah, totally agree. Um, okay, so you're mobile right now. Can you talk to us about your mobile practice and then also what you're working on right now with your nurture motherhood?
yeah, so I am mobile. I actually am practicing a little bit out of Thrive Pilates in Aberdeen. That's kind of
Awesome.
like I'm doing a shared room over there, which has been nice to kind of have a place that's just I can sit there and stay there. But yeah, that is my business, Pelvic Power. So Pelvic Power, I'm all about the empowerment, spreading the word out. So I wanted to make it blatantly obvious what I do. And like I said, I work with women with a lot of different of the dysfunctions, which I have loved. That's been a lot of fun. Now I'm diving more into Nurture Motherhood, which is going to be this all inclusive platform for women who are pregnant or postpartum. In our vision, right now we have an OT who also has some maternal nutrition education. We have two PTs. We're coming up with programming that you can follow fitness wise from pregnancy to postpartum. But our vision is to include like a counselor, especially like specialized in maternal wellness or birth trauma. We want basically an all-in-one healthcare platform for moms because we know how difficult access is. Even
Mm-hmm.
like we still have a 6-week check with our OB and that's it. And I'm just like, how is that still just it? So this is kind of, I think, bridging the gap of what is happening for our postpartum women and pregnant women. And I'm very excited about that. That's
That's
like the
awesome.
new project. So
That's
we're
awesome.
super pumped about it. And I think what's going to make it different is we do want it to be a community, not just this thing that we're like, here's the exercise and do it. We want to have that, but we're also going to have bi-weekly meetings so you can ask questions to us if you need further clarification or just to be like, hey, let's celebrate our wins or what do you need from us this week? So I think the community aspect, just for mental health overall, because it's such a changing time in your life, is going to be huge. And it's going to make us so different than what's out there right now. So
For
I'm very,
sure.
mm-hmm.
Yeah. So, I mean, the biggest question I think is like anytime someone wants to be progressive and have this holistic encounter with, you know, prenatal or perinatal fitness or pregnancy or pelvic floor PT or any of that, is are they pretty much expected to pay out of pocket? I know the insurance topic is like kind of hit and miss because, obviously I don't love the insurance company situation, but I recognize not everybody has the cash flow in order to pay
Yeah.
for the most progressive PT situation. So, what are your thoughts on that? Do you currently take insurance? If not, how are you balancing care with people who maybe have to pay out of pocket?
Yeah. So I am purely cash based. This may change a little bit, and that's just based on our area, TRICARE heavy. I understand the population that goes with that. So I'm thinking about
Sure.
going out of network with TRICARE. We shall see. We also might be moving, so I don't know about that. But I think people are seeing the shift in cash based, and it's for a lot of different PTs, not just pelvic health. I think that's the
Mm-hmm.
most popular one. But I think there is this big shift because I call the insurance companies the mobsters. Like
Yeah.
they're not looking out for patients, they're just looking out for themselves.
Mm-hmm.
Um, and it really can dictate how a PT practices, which is very sad. I
Mm-hmm.
think PTs also get pressured to see more patients because of how bad reimbursement is right now, which I think to me is very unethical for me to just sit there and yell out exercises to you when I have like 3 or 4 people, which was like my first job. I
Yeah.
absolutely hated it. Um, and I just didn't feel like I was using my skills the way I
Yeah.
should be, the way a PT should be. So I chose cash based really to practice the way I want so no one could dictate it. So there isn't this third party saying, hey, you did this, but we actually think they were better 2 visits ago. So actually, you owe us money back. Like, I just didn't want to play. They can do that. I don't know how many people know that, but they can do that and it can destroy businesses, um, which is very sad. It also, being cash based allows me to treat holistically.
Mm-hmm.
So, like, say you go to an insurance based company and your neck hurts, but the other day your foot hurts. Technically, they aren't allowed to treat that because insurance hasn't covered it yet, or they haven't said it's
Yeah.
okay. So, I can really adapt to what I do day to day, like truly based on how the person presents. Now, with that being said, like you said, not everyone's going to be able to afford it. And I understand that. And I think in order to improve access to healthcare in general, I think you need both. You need to have insurance based and you need to have cash based because there are going to be some people that can't afford it and want the kind of treatment that a cash PT clinic can offer. And so they're
Mm-hmm.
going to go there, and then it kind of takes away the flood that's happening in insurance based. Because what's happening in insurance based is, hey, we have a 3 month wait list. And you're like, well, I'm 7 months pregnant. I wanted to be seen now.
Yeah.
Yeah. Um, and I get it. The way I try to meet people where they're at as much as I can. And I think most people are like, well, PTs, you're going to see them 2 to 3 times a week. Absolutely not. I see almost all my people, at least in the beginning, 1 time a week, and I try to get them to commit at least 3 to 5 visits to make sure we're on the right track.
Mm-hmm.
Because we do have an eval, but sometimes you got to do some different things to make sure, like, okay, are we flaring up symptoms or is this making it better? So we're still like piecing things together along the way. It's a journey. It's not a like one and done. We got everything going on, right? And then I try to space it out every other week, every 3 weeks, whatever the person can.
Mm-hmm.
If they can't afford it, I try to give them the best referral I can to someone that I trust, to be completely honest,
Yeah.
because I understand it, especially in our community. Like you said, we're both military. We're in a military town. There's a lot of single income families, moms staying home with kids. I mean, I get it. And TRICARE is nice.
Totally.
Like TRICARE is nice. I get it.
Yeah. Absolutely. And, I've been, even I probably since COVID, more people have been thinking about the insurance conundrum, right? They're always thinking about like that entire complex that goes on. And I think the more and more I think about it, the more I realize like, insurance has a place and it's for really aggressive, acute situations, insurance makes total sense. But I think at the end of the day, when someone takes their own accountability and responsibility for their health, whether it's their birth experience, whether it's their strength
Mhm.
training, whether it's their race prep plan, skincare, all of it. Once you start taking that back and having that as a piece of responsibility for yourself, there are so many ways that you can improve. And I'm not selling you short on what you can provide, but I even think that there's so much you can learn as a skill through textbooks, through YouTube, through
Yeah.
Instagram, so much information you and other pelvic floor PTs put out to teach is incredibly useful.
Yeah.
So even though, obviously I want people running to you as patients, I always try to encourage people. Like, I think once you have this mindset that you're taking back that responsibility for your health, and you have that accountability with yourself, you will start noticing that like what probably happens is they will try the free stuff on social media and on YouTube. They get into it, they learn it, they want to learn it as a skill. Then they see the value,
Yeah.
then they're willing to pay the cash.
Yeah. And you
Typically, I feel
can't
like
avoid
is the
that
flow.
because you have all the influencers,
Mm-hmm.
and then they'll try this workout program and it'll make things worse. And they'll be like, well, what am I? So
Yeah.
there's a fine line with that, right?
Yeah.
Yes, there is a whole lot of information out there, but then you have to figure out, but is this the right one for me? And
Yeah.
why is it for me? And all these things. Because
Yeah.
I'll tell you what, the thing that irritates me the most is like, here are the 5 exercises that I did to improve my pelvic floor
Yeah.
dysfunction. And I'm just like, now everyone's gonna think it'll be some famous
Sure.
Fitstagrammer usually.
Mm-hmm.
Um, Obviously there's pelvic floor pages that also like give like helpful things, but I just
Sure.
hate it when it's like you should do these 5 things because it worked for me, so it's gonna work for you. I'm just like, that's when people start spiraling and be like, oh, well, it didn't work for me and nothing's gonna work for me.
Mm-hmm.
And that's when it gets on the bad end of
Yeah.
the digging for yourself. But you're right, there is so much information out there.
Yeah. I even think though, like which It's totally fine if we don't end up necessarily on the same page with this. I almost feel like it almost in the end might still be a net positive because even if they get worse, they're still seeking out pelvic floor PT. They then they need you.
Eventually.
Then they
Yeah.
need you eventually to fix it. Does that make sense? Like,
Yeah.
so like I totally get it, right? Like I see all these videos all the time, and I'm like, okay, well, I probably wouldn't have done it that way, but I'm glad you're learning. Like I'm glad you're trying. You know,
Yes.
I'll be here when you're broken because that's incorrect, but at least you're learning. That's
I like the motivation for sure.
for sure. Is everything going to be accurate on social media? Absolutely not. I guess my next question would be then, how do you feel about the influx of people talking about public health on social media? I would assume it's a net positive, but I'm sure there's
Yeah.
still frustrating points with people's different opinions.
Yeah. So overall, love it because I feel like you would have never seen that 15, 20 years ago, to be
Sure.
completely honest. Like there has been this huge influx of pelvic health knowledge and PTs just trying to spread information, which I do love that because I don't think, especially women, have gotten the care that we deserve. And we haven't gotten not just the care, the education, just the education
Yes.
on our own bodies from just school. Like
Yeah.
it's just wild to me. So I overall do love it. What I think this the other end of it, like we kind of just talked about, is the people who don't necessarily have any real background or education behind them, but they just decide, you know what, I'm going to talk about this because it's a hot topic. It is kind of a hot topic, right? Like public health is kind of the hot topic right now.
Sure.
And they're like, well, let me just get views. And that's when I think that's what annoys the crap out of me, honestly, is those
Yeah.
people who are just like, I'm just going to say this and get all these views because I already have all these followers. And
Mm-hmm.
I mean, who doesn't want to hear about empowering women and women's health, all
Yeah.
that kind of
Yeah.
crazy. But overall, I love the education piece. I think it is pushing, especially OBs, to refer out more, which I'm like,
I agree with that.
please, yeah, like, please. You still have some that don't believe in it, which I'm just like, how?
Sure.
But I think overall, the message is positive and I love it. Like I said, just like spreading the word and I think is amazing, especially in this generation. And then they go home and talk to their moms and grandmas and they're like, you know what? Like we just didn't talk about this because
Mm-hmm.
we were taught to just sit down, be quiet, hide ourselves,
Or that it was normal and that should just be expected. Like
Yeah,
like you should be
exactly.
suffering the rest of your life. And I always say, like, if a man was leaking out of his freaking urethra all day long, like, don't you think they would probably get it? Like,
Yeah.
is, they would get some form of, care. I'm like,
Let's be
what's going on
realistic.
here? Yeah.
I mean, there's still doctors that tell women like, "Oh, you're leaking right now, but are you going to have more kids? Well, you should just wait." And I'm like, "What? No. Like absolutely not." So there's still a lot of misinformation out there. There's still
Hmm.
frustrations in this field, obviously, but I love the direction it's going 100%
Good.
because I think the more you know, the more empowered you are, the more comfortable you are to bring it up to your providers, and the more progress we'll make just in general for healthcare.
Absolutely. I mean, even on my like initial intake form, on a lot of like my online Morinco stuff, I always say like, have you had children? Have you been pregnant? You have had children. Did you see pelvic floor PT? And they're like, no, I didn't feel like it was necessary. And I was like, okay, well, you're showing symptoms or you're telling me you're having symptoms. I'm like, so even on my end, I'm like referring people left and right. I'm like, even if you have regular insurance, I'm like, your insurance will cover this. Go, take advantage of it. Like, even if you can't, if you care about a holistic and a progressive way to do it all, then use your resources, use the money that you have to find a provider that you absolutely want. But if you just have regular insurance, if you're not taking advantage of that, you're nuts. That's it. That's my opinion.
Yeah. And it is hard because they are flooded So you do get that long wait list. I think
Mm-hmm.
we just need more providers in every
Mm-hmm.
setting, to be quite honest. And in my opinion, you should have a pelvic PT there right after birth.
Absolutely. I don't know. Also, I'm like, from a hospital system setup, I'm like, you realize it's like one more thing you can charge to the insurance. Provide the pelvic floor PT immediately. Like, why is that not part of the flow?
Like, like I had two cesarean births. They literally cut into like several layers of your tissue. No PT set. Yet I worked for a hospital that did back surgeries all day long. You best believe they had a PT right in there, right after, teaching you how to get into and out of bed and toilet and all those things. I'm just like,
Yes.
what? Like,
And
how
now
is
you're
this
responsible for another human being's life.
Yes. And they're just like, okay, you're going to stay here a couple nights and then you'll go home. And like, I myself will ask for an abdominal binder because it makes me more comfortable in the beginning. And I'm just like, shouldn't this just be you come in and hand this to me? Shouldn't this, like, there's other women that know nothing and they're
Sure.
struggling to get out of bed. And I'm just like, how is this still happening? I'm hoping it's
How?
changing, but not here. And I'm
Yeah,
just like,
I know. Yeah, the hospital system is like this giant cruise ship. It takes forever just to like change one thing.
and
But
yeah.
if women could do one thing today to work on their overall pelvic health, what would you say? I put you on the spot, but
I know. There's just so many things you can pick from because I will say most of my patients, I'll say like 95%, just nutrition wise and water intake alone is so horrible. And I'm like, I can do all the things in the world, but if you aren't hydrating and you ain't making that pelvic floor happy, it's not gonna do anything. Like what I'm doing.
yeah.
Like you need kind of like a good foundation there,
Mm-hmm.
100%. And then to build on top of that, I think it's awareness. A lot of people are uncomfortable with the topic, just in
Mm-hmm.
general, and are so, it's like that thing you don't see, don't look at for many people. And it just wasn't a normal thing talked about in the family. So honestly, awareness is huge in this profession because you need to be able to connect to it, uh, like at least a little bit. And I have
Mm-hmm.
people who are just like, I won't even look at it. Nope, not for me. And I'm like, but you need to know, just like anything else on your body, like if there's a change, you need to know that. It's just like anything else.
Sure.
And you start having, a lot of times with women, especially, we have these kind of negative thoughts. I get a lot of patients with negative thoughts about it, things like that. And I think not just awareness, but like a positive awareness. And I'm not saying like you have to think it's the most beautiful thing in the world. That's not the kind of provider I am. I'm not that kind of like, oh, it's a beautiful flower. That's not me. That's not my style. But I want you to just be okay. Like, be okay with yourself and be like, yeah, that's part of me. And yeah, I'm very aware of what's going on. Like, I can feel the tension there. Kind of like you said, you're like, that's the first time I really felt it. And
Yeah.
just having that awareness can be so big on just overall rehab or day to day life. So you can get to the point where you're like, oh, yeah, I need to relax a little bit. I need to take some breaths and sit down. So I think that's kind of a huge factor into
Awesome.
it.
Thank you so much for sharing that.
Yeah, of course.
Well, thanks so much for being on the show today, Allie. I appreciate all of your knowledge and being willing to answer all my wild questions.
Yeah, anytime. Like I say, I
Is there
love
anything
talking.
else you want to share with us last minute?
I don't think so.
There's
We've
so
covered
much.
a
There's so much
lot.
with pelvic floor,
Yeah,
but through a podcast, it
pelvic
might be kind of hard.
floor, women's
How can
health.
they find you? How can my people find you?
Easiest way to find me is through Instagram. It's dr.allieryan_pt. Allie is ALLIE. Or go ahead and follow Nurture Motherhood. So it's nurture.motherhood because I'll be posting more through there. And that's kind of the new little
Awesome.
passion project going on. Yeah.
Sweet. So excited for you. Thanks so much for everything, and I'll talk to you soon.
Talk to you soon. Bye, girl.
Bye.